The third virtual seminar of our series COVID-19 in South Asia. I'm Ashutosh Varshney, Director for the Center for Contemporary South Asia here at Brown. And today we have the pleasure of welcoming Mushfiq Mubarak from Yale University, Professor of Economics, who works on, among other things, on Bangladesh and will give us a presentation in Bangladesh. Adnan Khan, who is a professor of practice at the School of Public Policy at the London School of Economics. He's joining us from London and he'll speak to us on Pakistan. Then we have Paikiasothy Saravanamattu from, we call him Sara, from Colombo, founding executive director of the Center for Policy Alternatives. And those of us who worked in Sri Lanka have had the privilege of utilizing the resources and the intellectual capital lodged at the Center for Policy Alternatives there in Colombo a lot. So the plan is to, you have larger introduction in the announcement already sent. So in the interest of maximizing discussion, I will not go any further and invite first Adnan Khan from LSE to speak on Pakistan. Each speaker will have 15 minutes for the presentation, and then we'll open up for Q&A for the remaining 14 or 15 minutes. And from there, we'll go to Bangladesh and invite Mushfiq to speak on Bangladesh, and then finally to Sri Lanka, where Sara would tell us about the situation there. So Adnan, over to you.
Thank you, Ashu. Pleasure to be here to speak about the COVID response on Pakistan. I have a few slides. Let me share those slides with you. I hope I can find those. Yes. So here is the overall context. So I'll say a few words about the context, the policy response, and a take on the policy response in Pakistan, and also something about how the policy response could be different. So overall numbers, reported numbers in Pakistan are not that big at this point in time. The first case that was reported was in late February, and the earliest cases were the ones that came from Iran. Religious migrants, visitors who were visiting Iran and came back. The numbers have grown in all 4 provinces, more than 100 deaths, but still the numbers are not massive. Governments in Pakistan in general, there are 4 provincial governments and 1 federal government have reacted quite aggressively on this one. But also there is a differential policy response by different governments. Some governments have really taken the lead. I'll particularly mention the government of Sindh and maybe the government of Khyber Pakhtunkhwa province, KP, who are on top of the messaging, the communication, messaging, and also in terms of policy response. Other governments were initially in catch-up mode, but also have been responding quite a lot. But what we also see in Pakistan is a huge variation, heterogeneity in policy responses by different governments. Federal government, obviously responsible for the overall conduct of the policy, has taken a number of measures to address the economic impact of this in terms of firm, the state bank policy, a big fiscal stimulus and other things. And because this has directly affected the social safety net, the government has also come up with a huge big program under the Benazir Income Support Program, currently the program name being EHSAS, of cash transfers to 12 million individuals, about 70 to 80 million families, like a big household, like a population, who are directly affected by the current crisis. And this comprises 3 pools of 3 people. An existing pool of more than 4 million beneficiaries who are above the current base cutoff, were given basically a one-time transfer of 12,000 rupees, which is roughly like 72 dollars, in addition to what they're getting as a regular transfer under the BIST program. And there are 4 million new beneficiaries who are above the BIST cutoff, who will also be getting this one-time transfer. And third pool is a group of 3.5 million new beneficiaries to be identified using new methods. And those methods are partly by SMS-based targeting, self-registration, but also using local administration and Zakat committees for targeting them. In terms of the concerns, the reported numbers are small, but also there's a question of, there's been a acute shortage of tests, and there are big concerns about underreporting. And already we are seeing in some cities that there are a number of deaths which are occurring outside the hospitals, and some of them which have been in some cases, bodies have been dumped at mortuaries, and the mortuaries have been reporting that there seem to be coronavirus patients. Acute shortage of tests and also testing strategies, so we don't really know. And recently, there also have been reports of a spike in cases of dead upon arrival at hospitals. So, who also, some of them at least seem to be infected patients of coronavirus. And there is also a concern, broadly a concern about the government strategy. The government was proactive in a number of policy responses, but also in terms of having an extreme shutdown or a lockdown on the province, which it was claimed was essential, but which also led to massive outflow or migration of migrant labor from other parts of the country who went back to their places of origin, and to potential spread of disease vectors. Other governments were in catch-up mode. They eventually adopted some form of shutdown. But one thing that has been missing from the policy discussions is there is a choice between extreme measures or corner solutions, as we say, but the unintended and unmonitored consequences of those shutdown policies have not been discussed or internalized in the policy response. What we also see is a lack of clear priorities given limited existing capacities. In a formal life, I used to be a civil servant in Pakistan for more than 10 years. I know that bureaucracy and civil administration, even in normal times, usually operated in a world of firefighting mode. And today there is a real fire out there, and the response is a bit more chaotic than ideally it should be. And there is also concern about the impact of social safety nets, as there is a concern that temporary shocks can lead to long-term consequences in pushing people into poverty traps. And it could lead to economic dependency, increasing inequality, increase in parent-client type of relations. Pakistan was unique in establishing a social safety program, the Benazir Income Support Program, that was not politically targeted, that was based on an objective proxy means test. And it led to direct cash transfers. And there are studies, there is evidence that it led to less political targeting and had a real impact in terms of poverty and inequality and other measures also. Some of the current measures that are taken are, there's a concern that some of the data on which these are based is quite old. There's also an issue of the current shock being mostly an income shock, whereas those measures of poverty targeting have been mostly based on on measures of asset inequality. And as to whether the shock, which has been greater in urban areas, whether our current measures, our current numbers are adequate to capture those. And some of these, call it transmission mechanisms of providing cash to people in person, are perhaps also not best suited to the current COVID-19, the other policy goals of preventing transmission. Overall, some good things happen. But let me use my remaining time to talk about the real underlying challenge, the real problem being stuck between a rock and a hard place. So governments in Pakistan, but also globally, have been struggling to decide between two very hot choices: lockdown, shutdown, economy, everything closed. But then there's also a concern about the unintended consequences in terms of economic collapse and potentially even more people dying from non-COVID diseases. We saw in Nigeria more people having been died because of the police response or firing to impose a shutdown than the number of deaths due to coronavirus. Or the other option is to remain mostly open, minimize socioeconomic fallout, but then you could have a number of people being infected by COVID-19. And the real question in terms of policy is we don't really know how to make this trade-off. We don't have enough information to make these choices between health and economic impact. And is there a real trade-off, or is there some complementarity? And in the last few minutes, let me share something about what we and our group, Center for Economic Research in Pakistan, have been doing to address this. Basically, we have been utilizing the literature on decisions that are under uncertainty and using the limited information you have to make decisions, and then also take decisions with a view to learn more to make better decisions in the future. So our approach has the following, call it guiding principles. So first of all, it's based on promoting a concept of smart containment. So degree of social distancing determined using evidence, and in a way which also balances the cost and benefits of the approach. And the unit of decision making and the unit of implementation, not a national level, but the lowest level at which you can get, a local level. And that local level will vary from regions to regions, urban to rural areas, but taking actions which are evidence-based, but also at a local level. The second principle is active learning. Act now based on what you know, but also take actions with a view to speed up the learning that is needed, and then refine actions on the basis of the new knowledge that you acquire. Community messaging, compassionate enforcement. The response has to be data driven. It has to leverage existing capacity, so especially in developing countries where there's already limited state capacity, and we can't just blindly copy solutions from outside that in a way where the cure may be worse than the disease. So we have to leverage whatever existing capacity we have through improved coordination, improve efficiency, but also build dedicated new capacity, and empower local actors by utilizing local information. So my last couple of slides. So here is something that we are suggesting, and we're working with different governments in Pakistan, hopefully to take those to policy, which is rather than having these binary stages of shutdown, either no shutdown or a complete shutdown, to have a more graded, staged approach where we have an initial stage where we are preparing, where there are no cases in your area, to a next level where there are some infections which are detected, where you lead to some measures of social distancing, to a stage where you have multiple cases and you need to have a more severe case of lockdown, to a case, unfortunately, if it happens, where you have widespread disease and you need to restore and you need to adopt a very different strategy. At the back end of it is there are a number of actions that need to be taken. I won't go into all of those. So for all of those 4 stages, so smart distancing measures, what kind of data, what kind of testing approaches you need to have in order to screen, but also not just using coronavirus testing, but also syndromic testing, sentinel surveillance, and all of those other things. What kind of physical distancing or social distancing need to be taken under each of those stages? What kind of community messages need to be sent in order to promote greater voluntary compliance by the community? So it doesn't have to be a top-down authoritarian solution. And what kind of actions need to be taken by actors at local and other levels for each of those stages to take the right measures under each of those stages. So this is just an introduction to this. I can go into more details. I don't have the time. If you're interested in more details, here is the website where these plans are listed in far more detail, at operational detail, both the thinking behind this, the thinking behind the approach to active learning, but also the detailed implementation plan, the operational plan, and the assumptions behind it. Let me stop here.
Thank you. Thank you, Adnan. Let me start the Q&A with three questions for you. One, if I understood you correctly and the press reports, there is no national level lockdown in Pakistan as of now, right?
Yes,
Okay, so and you're not recommending a national level lockdown either. You're recommending a phased approach, or
absolutely.
based on the availability of data on relative incidents. Hmm?
Absolutely.
Right. Okay. Second, can you say something about the problem that everyone is commenting on, which is that this is more of a big city uh, issue, big city problem, the COVID-19. And it's not that villages and smaller towns are not affected, but the highest incidence is in cities. Is that true of Pakistan as well? And third, everyone is also commenting on the basis of worldwide trends that areas, whether cities or smaller towns, areas that have developed huge migrant pockets, um, are more affected than areas which have fewer migrants. Can you say something about that? So about the intercity spread and about the relationship with migrant populations. What does Pakistani data say about that?
So first, there was absolutely there was no national lockdown. At Sindh was had the most aggressive lockdown, and then the federal government also had a measure of lockdown. And recently, they have eased some of those measures. Um, in terms of its incidence, it's true that urban areas are most effective, especially in Sindh, where Karachi and other big cities are the most affected cities. However, it's not true that there is no incidence in rural areas also. It depends on the dynamics. And in case of Pakistan, one of the first major incidents was in KP province, where a visitor from Saudi Arabia who came back and who was infected threw a big party in his village, and with all of the like our traditional style of celebrating and commending someone, um, all those hugs and everything. Anyway, that led to a massive increase in infection within the village, to an extent that that person unfortunately died. Initially refused to be treated, then was taken to hospital, but didn't want to be quarantined. Came back, ended up infecting others. Eventually, when the government tested, there were more than 150 cases within that village, um, and um, and they ended up quarantining. Again, that was a good example of smart quarantine, where they ended up quarantining the entire village, UC Manga and KP, and provided them food, medicine, and other things. And eventually, when they lifted it a few weeks later, there was no one, as per the test again. Um, the some who were treated and others, the testing was negative. And there are other rural areas also. The two first major sources of disease transmission in Pakistan came from, one were migrants, mostly not migrants, visitors, religious visitors to Iran, who came back and spread throughout the country. And later, when they were discovered, they were put in quarantine. So they were the first source. And the second was people who migrated from economic migrants abroad, who came back from Spain, Italy, and other places. And those mostly come from villages and rural areas in central Punjab, areas like Gujarat, Jhelum, Ahmedabad, and their villages were also quite affected. So it's not the case that the rural areas are completely safe. Yes, there are there is a greater degree of distancing in others. Uh, in terms of migrant population, yes, you're right. It depends on the patterns of migration. And initially, there were also biases against migration. Also, these religious visitors that led to also some sectarian connotations of those who were infected and who were bringing the infection, which was unfortunate. But there is a huge population of informal migrant labor in large cities in Pakistan, Karachi, Lahore, and all of the large cities. And unfortunately, the food and shelter is a huge, big problem for them. And after either the formal shutdown or the informal measures taken by governments and by businesses, which led to big shutdown of industry and others, um, the initial policy measures to reaching out to these populations were not adequate, were not quick, and that led to a massive migration from urban to rural areas. So, Karachi in particular, but also urban other areas. And unfortunately, many of them are also not targeted by the social protection measures that the state is taking. And there is a concern that many of them may have been unwitting disease vectors. So far, because the testing has been very low, it's not very clear, it's not very obvious how much this has spread from these migrant populations.
So would it be fair to say that as far as we know, the spread of COVID-19 in Pakistan also begins with migrants? Is that, I'm not trying to target any, I'm just analytically, I'm trying to understand, is that true or not?
It is true that initially, and that's maybe true for other contexts also, because initially these came from outside, either travelers, visitors, or migrants coming back from either temporary or other visits. But it quickly led to internal transmission also of people who were not in contact with the visitors or migrants.
Okay, one more question before we open up. The China-Pakistan relationship is very close, and we hear it not only in IR, international relations literature, but if you go to Shanghai, go to Beijing, you hear the policymakers saying the same thing. Now, there are parts of Pakistan where the Chinese investment is very substantial in Chinese populations. Chinese people from China have come and at least temporarily settled down. Is there any, what do we know about those places? Are they more COVID prone, or the Chinese presence there has nothing to do with COVID?
So, although there have been like biases and maybe concerns over social media and other places, so far, to the best of my knowledge, there are not any cases of the Chinese population or migrants or visitors having spread coronavirus in Pakistan. This is also borne out by genetic studies of the version of coronavirus circulating in Pakistan is different from the one that is that was widespread or prevalent in Wuhan and other places. Our version is mostly coming from the Middle East and Europe. The other part of this China connection is also there's a large number of Pakistani, mostly students, but also visitors who are based in China. A large number, many hundreds, in fact, in Wuhan. And the Pakistani government decided not to bring them back, a decision which was initially very unpopular. And they were taken care of in Wuhan. Eventually,
by China or by Pakistani embassy there?
I think by a combination of both. So mostly by China, but Pakistani embassy also pitched in. They were in contact with them. Eventually, from all the messages that we have seen, although their parents and communities were worried, they ended up being. They were also not. Most of them were also not willing to come back. They were happy there, and that may also have helped limit the transmission between China and Pakistan.
I see. Let's open up for questions. We have about 7 minutes at best. So are there any questions from the audience about Pakistan? Omar, do you have a question?
Yes, thank you, Ashu. And thank you, Adnan. This was a really wonderful presentation and laying out and depicting the situation in Pakistan. I just had two brief questions, which I'm going to merge into one. Could you speak a little about two aspects of the COVID response and the COVID situation in Pakistan? Basically, firstly, the religious dimension. I mean, only yesterday, a group of 49 or 50 clerics met and are sort of really putting pressure on the government to open up mosques. Even I was reading Dawn just now, earlier this morning, and Friday prayers did happen in some parts of the country. So could you speak a little about how that sort of presents a challenge to the government, and how might the government tackle that issue? And then secondly, I'm really interested in my PhD on civil-military relations, and the military has clearly been supporting and propping up the government in its COVID response. I was wondering if you could speak a little about the military's response as well, because for instance, the NCOC, the National Command and Operations Center, had been set up, and it is being led by a lieutenant general from the army, and one of its key functions, and I'm reading this from Don, is to ensure effective coordination between federal and provincial governments in this national campaign against the pandemic. So could you speak a little about the military's role in, I guess, the national role, as well as sort of bringing the provincial governments closer to the national government as well? Thank you.
Thank you. Great question. So first of all, on the religious angle, yes, initially because it was the transmission of the disease was blamed on a lot of Shiite migrants who were coming back after visiting religious sites in Iran. That increased sectarian, that had a sectarian angle also. But the most important, I think, dimension is any measures of social distancing are not effective unless a large proportion of the population who are led by religious scholars and ulamas also doesn't comply. And that has been a problem in Pakistan for a long time. In my former life, as I mentioned, I used to be a civil servant administrator in Karachi, and half of my life was spent in dealing with these clerics and ulama, which was not necessarily an easy thing. To be honest, like the response of many of our clerics and others has not been positive, has not been helpful in this situation, in that they have paid a lip service. Most of them have paid a lip service, but not either accepted state's writ on this issue, or adopted any responsible attitude which promoted voluntary compliance and social distancing and hygiene practices, a number of other things that they could promote independent of the government. And the challenge for the government, and we can criticize one particular set of government, but that challenge has been there for any government, is they don't want to use force, but again, they don't have many other instruments also for having these clerics aligned with state policy. And if I'm honest, the current government has also not tried its best. So some parts of the country, Karachi in particular, they try to have the do it by force. And I wouldn't say completely backfired, but also wasn't accepted by or led to strong resistance, I would say, particularly in the Pashtun population of the city. So again, it's an ongoing challenge. It's something call it a weak state capacity. All countries have to face this. Pakistan in particular, it is an issue. Going forward, I don't have a solution, but we need to find and government also needs to step up in order to engage with them, but also to have some measure of both enforcement, but also convincing and voluntary compliance. This also was hoping for some responsible attitude on the other side that we haven't seen. In terms of the civil-military relations, yes, it is true. Military has a big say in Pakistan, and in the current crisis also, we are seeing them playing a big role. They're also an institution that has the enforcement capacity, and if you are led in a world of shutdown and lockdown, then as happened in Pakistan, all provincial governments also directly requested under the constitution army to step in and to help them. Done the right way, I think army can also support. It has obviously, it has some strength, organizational strength. But I think the challenge is civilian governments in Pakistan have been weak, both politically, but also in terms of capacity to formulate and design and implement a response. And when you leave gaps in policy design and implementation, other actors out there will obviously come in and fill those gaps. That's something that both this government and future governments also need to address.
Thank you, Adnan. We can take one more brief question if anyone has them on Pakistan. Okay, thanks, Adnan, for your presentation.